Hello, everyone. This is Dr. Judy Shaw with Shaw Medical Travel Consultants, and today we have the pleasure of interviewing Mr. Ed Stevenson. I'm going to give you a little information about Mr. Stevenson. He's originally from Montego Bay, Jamaica, and attended high school in Jamaica, Monroe College and Cornwall College. Higher education, Bachelor's of Science in Biology was received from Long Island University, and a master's degree in community health from Howard University and in public health, University of Pittsburgh. He has well over 40 years of experience in healthcare, ranging from development and management in healthcare services, programs and facilities, to consulting with hospitals, physicians, and government agencies, both in the United States and in the Caribbean. So, Mr. Stevenson, you can tell us what you are doing currently and the company that you are currently working for. And then we are going to share 5 tips to becoming accredited by an agency in order to facilitate the development of medical tourism in countries outside of the United States. So, Mr. Stevenson, go ahead and tell us what you are doing currently, briefly.
First, thank you for having me on. And I'm an independent consultant, but I have affiliations with companies which provides accreditation services globally. The Caribbean is a region now that is looking seriously for the past, well, say 5-10 years now of getting into that area. You know, so yes, it's complicated, but it doesn't necessarily have to be if you're open-minded, if you're committed.
Yeah.
You know, and it takes time.
Yeah.
It's not an overnight thing.
Yeah. So patience is another one of those things we should have added. Patience.
Oh,
Yeah. All right.
we tell them. I mean, we're very upfront about the time frames, and again, we're flexible about the average time would be, say, from the start to the time of accreditation is about 2 years. Sometimes it could be shorter, depends on how quickly they get on board and doing the work that has to be done. Once they do all of that, there's a site visit by the surveyors, who are usually people experienced in some clinical aspect. It could be nurses or physicians or both. After that, a decision is made, and if they get full accreditation, if they've met all the requirements, it's a 3-year accreditation that they receive.
Great, that's good information.
There's some issues that have to be, worked out before they may get a conditional accreditation, and then during the condition period, they have to come up and rectify the issues. Mm-hmm. But it can be done. We're proud to announce that we have now moved into dental tourism. We have standards and programs for dental tourism. So programs for rehabilitation. There's a program for in vitro fertilization, IVF. So there's a range of different programs, mm-hmm. Of course, from the clinical, the hospitals, the clinics,
Excellent.
So there's a lot involved.
Excellent.
Yeah.
So you are definitely qualified to give us some tips and great information here for to help folks move forward in their quest for getting accredited. Tell me, share with us, if you would, what is a benefit, briefly, what is a benefit of becoming accredited outside of the United States? Help us understand the value of countries outside of the United States conforming to the standards of the various different bodies of evidence and the various different regulatory bodies. Why would I need to do that?
Well, first of all, the value of getting into it. I mean, to become accredited provider is that you are demonstrating to a potential patient that you are now meeting standards on a worldwide basis. It's not just the United States or the British or whichever country or Canadian, wherever. You're looking at standards that are accepted globally. So that's.
And why is that important?
Well, because first of all, the potential patient has no clue or background about the facility that they're going to go into, but it is reassuring to know that this is a facility that has achieved the quality of care and services that are accepted worldwide. So that's on the say the consumer side. For the provider end of it, insurance companies look more favorably on paying for services if they're accredited. Again, it comes back to quality, that they are assured that they're providing a standard of care that is accepted worldwide. So, and then also there's the marketing value. Providers can say on their website and marketing materials that they are accredited by X, Y, and Z organization. And that means a lot.
Absolutely.
There's great value in saying that you're accredited.
Right. So as it relates to the issue of quality, as you mentioned, I'll just put this out there, the 6 domains of healthcare quality, which many organizations actually look for as the basic tenet as it relates to quality of care delivered, are safe environment, effective policies and procedures, effectiveness as it relates to based on scientific knowledge, patient-centered, providing care that is respectful of and responsive to individual patient preferences, timely, meaning reducing wait times and sometimes harmful delays, both those who receive and those who give care, efficient, again, avoiding waste. Before we was avoiding wait times, this is avoiding waste and including waste of equipment, supplies, ideas, and energy. And then lastly, equitable, which is very important, particularly nowadays, providing care that does not vary in quality because of a person's characteristics, such as gender, ethnicity, geographic location, and socioeconomic standard. So right now, let's go into some of these tips. So again, we have 5 tips that Mr. Stevenson is going to give us. So you're going to want to listen all the way to the end. So let's start with the first tip. The first tip being commitment. So tell us a little bit about what that means and what that entails.
That's very, very important because it speaks to the leadership of the organization, from the senior management, the board of directors, all have to be on board that they want to go down this path. It just cannot be an individual's desire. It has to be a group appreciation, and this is what they want. This is the path and the future of where they want to go. So commitment is definitely important. And then it also has to be not just on the management level, but it also has to be done at the lower levels. In other words, all members of the organization, from frontline staff, all have to be committed to achieving this objective.
How would someone go about trying to get commitment from exec level all the way down to the person cleaning in the rooms?
Yeah. Well, obviously, each organization may have their own way of doing it, but definitely to share the vision, it would have to be done through the different levels of organization. You can have the managers at the middle end of the organization. Let them know what's important. Let them know what the goals and objectives are, and then they in turn can then do their own different approach to getting their own departmental staffs involved. some organizations may just have one meeting, like you know, a day that everyone sort of goes and they listen, to get input from all the different staff, that this is what we want, we'd like to get your input. You know, it all depends how each organization communicates with everyone. But so it can be top down, or it can be, you know, from the bottom up. But I think it's important that at the end of the day that they're all on the same page, that they all agree this is where. And again, each department has to see what's in it for them. Where do they benefit? You know, and if they see where their knowledge base is going to increase, the competencies, the skill sets are going to increase. And so each staff person will see, well, wow, you know, this will make me more knowledgeable, my skills will be improved. You know, I can get promotions, or I can get, you know, set me up for increases. So it has to be where everyone buys into the concept, and they see where it benefits them as well as the group.
So that leads to the next point, which is engagement. So, you know, you commitment from your leadership, and then engagement from leadership all the way down. So whether it be a top down or a bottom up, whatever the culture is of the organization, but the buy-in is key to the success.
That's very key.
What you're saying.
Yeah, yeah. And then also engagement from another angle is, okay, so the organization wants to go down the path of getting accredited, they want to get into medical. The next important part is then to select the right accrediting body. I mean, there's a lot of them out there, but it's important that they find an accrediting company that embodies all those things that we're talking about, but more important, that they have they're flexible, they're adaptable to the environment. In other words, no one set of standards or approach fits all.
Right.
There has to be some flexibility, particularly when it comes to culture.
Right.
You know, cultural sensitivity.
Key. Very key.
Very key. And that's why there are some companies, but they bring their standards and says, take it or leave it. You know, this is it. It works over here, and you know, so. But other companies take a different approach, and you know, the one I'm affiliated, you know, they take that into that's very top of the list of the priorities, that they look for cultural sensitivity, flexibility in terms of adapting to the company's culture. So
because I mean, the reality is you may want to do medical tourism, and this is a recipe sometimes that can set people up for failure, because as you mentioned, the organization. So you know what happens, you know, we've seen where an institution, an organization, or a group of physicians want to get accredited, and so they want to adopt policies and procedures outside of their region, and you know, the mentality, the way of practicing differs in different regions. The way of collaboration differs in different regions. Expectations differ. So all of these basic issues have to be addressed, raised, understood, how we do things, and what the recipe of success will look like, how we do it. Has it worked? If it hasn't worked, then maybe we need to sort of change. So that cultural aspect of things, but not just the culture, I think, but also understanding the history of healthcare in the region. Exactly. Because different regions have different healthcare belief systems, different governance, different methods of regulatory management. And so I think it's imperative to appreciate that as well, don't you think?
Yes, and I'll give you an example of that in the Caribbean, because Historically, in the former British Islands, their healthcare system is based off the British model. If you go to, say, Aruba, it's based on the Dutch, the Netherlands model. If you go to, say, Guadeloupe, Martinique, it's on the French system that they're based their systems on. And so therefore, you just cannot go to an organization and says, well, my system is the one we're used to. It's accepted in a couple other countries.
Yep.
But if you're not taking into consideration the foundation of how these facilities, where the environment that they operate on.
Because that's a good example. But the third element that you had mentioned is that of research. So tell me a little bit about why that's important and what that means.
Very important, because in order to go in a certain path that you want to go, you need to know, you have to develop the roadmap.
Yeah.
You know what is at the end of the tunnel, you know. And what I found dealing with people, oh, they hear about medical tourism, it's very lucrative. Yes, but what segment of the market are you going after? Is it the wellness part? Do you have a center of excellence that you want to target? Do you want to target people in the diaspora? When I start asking various questions, it's, you know, you just get a blank stare, you know, it's like, well, you know, but that's why you have to hire, if you don't have it in-house, you hire consultants to do the demographics, the market research. So you know that all this time and effort and money that you're going to have to put into this, you know, you have the roadmap in front of you as to what you want to achieve. You know, do a gap analysis, do the whole 9 yards. And unfortunately, most physicians, hospitals that are physician-led, they know how to practice medicine, good medicine. But on the administrative side, the planning side is where they fall short.
So just a little segue. So an organization such as yours, would this information, this research, these doctors, these corporations, these organizations need to do this before engaging with an organization like yours? Or is this something that your organization would carry them step by step?
Okay, so usually when someone approaches me, an organization contacts me and they said, we're interested in medical tourism, I said, let's have a conversation. And then we lay out what their ideas are. I'll lay out to them what will make it successful. So we have to start with communication, having a dialogue where we can see if they're really, and by doing this, after we've just have a discussion, maybe it'll take a couple of meetings or two, then they realize that once they realize what needs to be done, then it says, okay, once they see the reality, okay, of what has to be done to get into this, because, you know, they look at this market and they see other countries who are getting, you know, doing very well, but they don't know how they got there.
Yeah.
Again, you know, looking at not just from the providers, but from the government's point of view. The governments in the Caribbean have well-developed tourism destinations and our product. And obviously they say here, medical tourism, they say, oh, well, no, we have good doctors, we've got good hospitals. Let's go in for that. And again, they don't do their research.
Right.
And
very important.
Yeah, there's a lot that the government has to do in terms of regulations, policies, looking at what to do to grow, to stimulate that segment of the economy.
Yeah.
So it's at different angles, but it can be done, but it's not going to happen overnight, particularly when you're not used to it. you know, so again, it comes back to commitment.
Yep. Okay. Excellent. Excellent. And then you touched on a little bit, so we'll go there now. That change mindset.
Mhm.
Okay. That's another really important,
Yeah.
very key issue. I mean, you may have the commitment a lot of times, and you may have wanted to do this, but when it comes down to get, you know, the rubber to the road, you know,
Exactly.
maybe I don't really want to, maybe I don't really feel like changing it. Right. That's just,
So the example I was giving you, I mean, it's human nature to resist change.
yes.
That's just human nature.
Mm-hmm.
And so when you have staff that have been doing things for decades, I mean, that's all they know, and now you're coming in to introduce a new way of doing the same thing, you know, it's just human nature that you're going to resist. Now, I use that example in the Bahamas. That was one extreme because it took them 10 years. And the biggest issue there was getting the staff to change to go with what was necessary in their own areas. In the Cayman Islands, on the opposite end of it, that hospital that was just built, I guess it's about 5 years now, it was from the ground up. The standards were built in as construction, as all the different parts, elements were being put together to put the institution together. As a result, when all was said and done, they got their accreditation in 3 years. First out, right? And that's because the staff, all the leaders, the leadership, everybody was on board, was committed to getting it done right, and it shows.
That's a great example.
Yeah.
That's a great example. So from a change mindset, so, you know, when you think of change mindset, change mindset starts with the person in the mirror first. Right. So a lot of times you see with, you know, with new ventures, things like that, there's a lot of excitement about doing it. But then it means that Doc A and Doc B and Doc C are now going to have to be aligned, working together towards the same objective. Even though we may be practicing different ways, we may all be in the same system in order to make the system itself successful. So for the system to be successful, then of course we all have to put put in our work, in order for the entire thing to be successful. And then when the entire thing becomes successful, then we as individuals will also become successful. But that change management and change mindset is huge because doctors notoriously don't like change much.
Very
and
true.
When doctors and healthcare organizations have a recipe for them, in their mind, at least, that works, it is going to be very difficult to say, okay, so that worked then, but this is how we want to do things now. So this is how you might have to change what you're doing now. You know, that change thing is where I want to put a little plug in there.
Right. So one of the key points in accreditation is patient outcomes, quality, there are clinical outcomes, and then there's the management outcomes.
Yes.
But from the clinical aspects, you want to make sure that the patient is front and center.
Patient-centric.
So all the services, the training of the staff, everything has to be focused in making the patient having a quality experience.
And then lastly, the last one is appreciating that the healthcare is a dynamic environment. And boy,
yes,
we know that, I mean, so, you know, it's definitely dynamic. So help us understand that a little bit as to how that relates here.
So in reference to the standards for, again, relating to accreditation, the standards used for today, right now, may not be the same set of standards in the next year or the next, whenever next time that comes around to get reaccredited, because the environment has changed, and then globally accepted standards, and therefore it has to be incorporated.
Yeah.
So you cannot just sit on one set of standards. Well, this is it. I'm happy now. I don't have to go back. No. Technology changes rapidly today, and all healthcare technology, AI, everything, electronic medical records, everything is evolving rapidly. So the set of standards that incorporates what services are being used now, whether it uses technology or some other new service, you have to agree that, again, coming back, that this has to affect the patient. You want to improve the patient's experience and quality outcome. So yes, dynamic, it cannot be static. It will not be the same when
Yes.
the next time it comes around to be reaccredited. That's just the way.
Yeah, absolutely. Yeah, I mean, especially now that COVID hit, there's a lot of changes that have been made as it relates to quality standards, as it relates to expectations, outcomes, and of course, there's a lot of unknown in this environment from a clinical standpoint as well, with conditions and diseases and disease states and all that kind of thing. So yes, but fortunately though, your organization, I would imagine, would obviously update physicians and physician practices and those kinds of organizations as it relates to changes that either are coming down the pike or currently in place.
Yes, and I'm glad you mentioned about the COVID pandemic, because the organization I'm affiliated with was the first to come out with a set of standards directly focused on the COVID-19 pandemic. And it is up to the organization, and we're offering it for free.
Yes.
You know, if they wanted to get a certificate of completion, you know, there's another process for that, but any organization could apply for it, download it from the website, and use them.
I want to go ahead and just take a few minutes for you to just give us an explanation of your organization and how your organization differs from other organizations that are out there for accrediting companies outside of the U.S. So how would your organization differ?
Okay, so the organization I'm partnered with is Teemos, T-E-M-O-S, and they're based in Germany. And relatively new. I think they're going on 20 years now. I'm involved in terms of targeting the Caribbean region. It's been more of a challenge here, again, because of the mindsets. But other developing or developed countries have rapidly come on board with them. The Caribbean is set for this. We're not just looking at medical tourism. Once you get these standards in place, it's the local population that's going to benefit. Those are that's the population that you're serving 90% of the time. The point is that you just can't introduce a set of standards for one set of your patient population.
Right. There's that equity.
Affects everybody. And so therefore, as I said, the majority of the users are going to be locals. And if you improve the quality of care for them, then of course, anything above that is icing on the cake.
That mindset that you're talking about.
Exactly.
Okay, so basically then, as we get towards closing, we're also obviously going to have information to contact you, your organization, website, and things like that here on the screen, and where individuals can contact you if that's something that they want to get more information about Teemo. So the information is there, and so we're going to go ahead and review these tips that you provided us. There are 5 tips, and commitment,
right?
research,
Right.
engagement,
Right.
change mindset is huge, appreciation of the dynamics of the environment.
Yes, and again, I emphasize the cultural aspects of
Cultural
this.
aspect, yes, can't forget that.
That's very important.
People are starting to look towards the future again.
I'm advising my people that are coming to me, take this time now to prepare. You couldn't want a better time now
Nope. Right.
But if you want to get into this medical tourism market, this is probably the best time to prepare. Do the homework, do the research. You know, start having talks with your staff.
Absolutely. Wonderful. Well, thank you. And on that note, we're going to go ahead and close. So I appreciate again your time. And this is Dr. Shaw with Shaw Medical Travel Consultants. I would like for you to go ahead and like this video. Click the little button to like this video if you thought it was informative. And mostly also please subscribe to our channel for this and many other videos that we're going to be having. We're bringing quite a big series as it relates to medical tourism coming to this medium. And also take a look at our website and some of the blogs that we have as it relates to medical tourism as well. So Mr. Stevenson, thank you. This is Dr. Shaw Medical Travel Consultants, and thank you.
Thank you. Okay.